This story starts January 13th, 2020 in Thailand, when a woman arriving recently in Bangkok from Wuhan tested positive for the newly discovered novel coronavirus, COVID-19. This was the first confirmed case of the virus outside of China. Then, the second confirmed case came in Japan, where a man tested positive sometime around the 15th of January, more than a week after returning from Wuhan. This was the second case confirmed outside of China. And then, just 4 days after confirming their first case of coronavirus, Thailand found a second positive case in its country from another traveler from Wuhan on January the 17th. The next international case came on January 20th, with South Korea confirming its first coronavirus case in a Chinese traveler coming from Wuhan. And just the next day, the United States became the first country outside of Asia to have a confirmed case of the virus, with a man testing positive in Washington state coming from Wuhan. By this time, the world was beginning to take notice, and the World Health Organization issued an updated report outlining the situation. On the 22nd of January, Thailand reported 2 new cases of COVID-19, bringing their total to 4 cases already. Then, on the 23rd, Singapore reported its first case from a man visiting from Wuhan, with a few cases still pending in the country, while Vietnam reported its first 2 cases of the coronavirus on the same day. And 1 day later, on January 24th, Japan, South Korea, the United States, Singapore, and Thailand all reported additional cases. And meanwhile, Nepal and France also reported their first cases of COVID-19. At this point, the World Health Organization had confirmed human-to-human transmission of the virus outside of China confirmed in Vietnam. By the next day, Canada, Australia, and Malaysia all discovered their first cases of the coronavirus, with 11 countries outside of China now reporting cases. On January 27th, Sri Lanka, Cambodia, and Germany all reported their first cases of the virus, with previously mentioned countries also adding new cases. By the 29th, the United Arab Emirates and Finland reported cases of COVID-19, while emerging hotspots like Singapore, Germany, and France continued to add new cases. And on January 30th, the World Health Organization declared a public health emergency of international concern relating to the coronavirus, as the virus now spread to India, Philippines, and Italy on the same day, along with the first confirmed human-to-human transmission in the United States. The next day, United States President Donald Trump suspended entry into the USA for foreign nationals who had been in China in the last 14 days. At the time, this was considered something of a controversial move, although Trump would follow this with downplaying of the virus in the following weeks afterwards. Also on the 31st, Spain, the United Kingdom, Russia, and Sweden all reported their first cases of the coronavirus, with a total of 26 countries and territories infected at the end of January. At the beginning of February, the world was taking notice of the coronavirus, although normal life would continue in most places outside of China for weeks to come. Fear began to dissipate at the beginning of February as the rate of growth outside of China was beginning to slow, and very few countries reported their first case at the beginning of the month, with many others implementing travel restrictions on China. The next country to report its first coronavirus case was Belgium on February the 4th, and although other countries continued reporting cases, we did not see any significant numbers taking off during this time. The next major development came in early February, with the Diamond Princess cruise ship becoming a hotspot for the virus after departing from Japan. When all was said and done, 712 people out of the more than 3,000 on board tested positive for COVID-19, with 11 people dying. This mass contamination should have been a warning sign to the world, but instead, cruises and other mass gatherings continued on well after the Diamond Princess debacle. The next country to add its first case wasn't until February the 14th, when Egypt became the first African nation to report a case of the coronavirus. At this time, 608 COVID-19 cases had been reported outside of China, and we were just days away from emerging outbreaks spotting up in South Korea and Italy. And on February the 19th, South Korea reported 20 new coronavirus cases in one day, the beginning of a large escalation in the country. And Iran also reported its first case on that day, as they were just days away from their own outbreak. On February the 20th, South Korea's cases more than doubled, going from 51 to 104 confirmed cases of coronavirus, while other countries continued to grow. Global cases outside of China now stood at over 1,200. The next day, Israel and Lebanon each confirmed its first case of COVID-19, but this is the day when things really started to escalate elsewhere. This is when the first signs in Italy of an outbreak emerged, when 17 new cases were confirmed, taking the country's total from just 3 up to 20. Meanwhile, South Korea's cases nearly doubled again, while the total cases in the United States and Iran more than doubled on the 21st. On the 22nd of February, Italy reported 59 new coronavirus cases, to a total of 79, with Lombardy region emerging as a spot of concern. Meanwhile, cases in South Korea doubled again, with 229 new cases added. At this point, the global total outside of China had reached over 1,700. On the next day, several towns in Lombardy region in Italy went on lockdown, with 73 new reported cases in the country and a third death. Cases continued to be added elsewhere as the official death toll outside of China stood at 26. On February 24th, a plethora of countries confirmed their first cases of COVID-19. Afghanistan, Bahrain, Iraq, Kuwait, and Oman all confirmed their first coronavirus case this day. The 24th saw a new high in daily cases outside of China as the virus truly began to go international. February 25th saw 5 more countries confirm their first cases of coronavirus, as Algeria, Austria, Brazil, Croatia, and Switzerland all confirmed COVID-19 cases. By now, almost 40 countries and territories outside of China had confirmed coronavirus cases, with many more to follow in the coming days. On February 26th, 6 new countries confirmed their first COVID-19 cases, mostly in Europe. Georgia, Greece, North Macedonia, Norway, Pakistan, and Romania all confirmed their first cases on this day. Meanwhile, the situation in Italy and Iran continued to worsen, and dozens of countries were now reporting daily cases. 56 deaths outside of China had now been confirmed. As the month of February started to wind to a close, the growth of the coronavirus outside of China only continued. The 27th of February saw Denmark, Estonia, the Netherlands, San Marino, and Nigeria all confirm their first cases of COVID-19. At the same time, signs of potential outbreak in France, Germany, and Spain emerged with an increase in new cases. Cases in South Korea, Italy, and Iran continued to grow, with Iran's death toll the highest outside China, now at 22. On February 28th, 7 more countries confirmed their first coronavirus cases, with cases now reported in over 50 countries and 6 continents worldwide. Azerbaijan, Belarus, Iceland, Lithuania, Mexico, Monaco, and New Zealand all added their first cases on the 28th. And in Iran, 4 members of parliament had now tested positive as the virus was hitting the top levels of government. This was the first day of more than 1,000 new cases confirmed outside of China. By the end of February, almost 7,000 COVID-19 cases had been confirmed in more than 60 countries and territories outside of China, along with 107 confirmed deaths. At this point, South Korea, Italy, and Iran remain the main spots of concern, though this list would expand significantly in early March. The month of February ended with Ecuador, Ireland, Luxembourg, and Qatar confirming their first coronavirus cases. Thanks for watching, and stay tuned for part 2 when the epidemic became a pandemic with a significant outbreak in March.